We've all got the same 24 hours in a day. What you do with it is up to you, and the supplement you take can help you make every hour count. For the maintenance of good health, choose DS24. DS24 provides the perfect balance of vitamins, minerals, antioxidants, and essential fatty acids to make every day your best day. Your life demands DS. DS24 multivitamin and mineral daily supplement. Find the full DS range at all good pharmacies.
Evening, everyone, and welcome to the first WiSH Cycling Interest Group webinar of the year. It's a bit of a late start to the year, but we're so glad that we can kick off, and we have a great speaker tonight who's going to kick off the first webinar of the year. So before we introduce our speaker, I'd just like to thank the sponsor, Asino, who without them, these webinars wouldn't be possible. So just some housekeeping rules for this evening. If you have any questions during the talk, please pop them into the Q&A. We will have a Q&A session at the end of the presentation. And then during the Q&A, if you also want to ask a question, you can raise a hand and we can then ask you to speak. Additionally, just ensure that anyone gets the CPD points that they would like. Please make sure when you do sign up for the webinars that you put your full name and your full surname, as well as if you have a MP or BK number, just to put the MP before you fill in the number and then the correct email address. Okay. So kicking off this evening, we're going to be having Parys Edwards. Parys is a physiotherapist. She graduated at Wits University in 2000. And her extensive CV includes work in trauma and orthopedics, as well as A&E and private practice. Plus, she's had further experience in the area of sports injuries, working with athletes from the Weekend Warrior to Olympians, plus 5 years as the physio to the England under-19 women's football team. Parys herself has a very keen interest in sports, being a great sports person herself. She's had a very successful career playing hockey for SA at both provincial and national level, as well as representing the English Premier League champions Leicester Hockey Club for 6 seasons. And when Parys moved to London, she joined a triathlon club in order to stay fit and meet people. And this sparked a great journey towards age group success, winning multiple British and European titles, as well as the World Championship title twice. And this then led to a 5-year competitive career as a professional triathlete for Great Britain. So Parys will be talking to us on cycling from a triathlete and physio perspective. So I'm going to be handing over to Parys. Thank you so much.
Thanks, Megan. Right, we are going to get my slideshow up. Hold on 2 secs. Oh, it was here a second ago. Do I need to share? I need to share screen. Sorry, guys. Remember, oh, there we go. Share screen. We're in. Thanks very much. As mentioned, a little bit of background on me. Back in 2005, you would have seen me in Leicester hockey kit, playing hockey. It was a frustrating journey for me in the end, hockey. I never did get exactly where I wanted to go. And I was so fortunate to get a second chance at elite sport. And when I moved to London, as I mentioned, I joined this tri club, full on tri, and I found my niche. And I raced successfully for 7 years as an age grouper. And at the tender age of 37, I had a decision to make, either stop triathlon as an age grouper and focus more on my work, or take the leap and go pro. And I thought, do it 1 year, don't embarrass yourself, you'll never get a chance again. And I didn't look back. I had 5 quite roller coasterish years as a pro, a lot of injury baggage from my hockey, but a decision I've never regretted. I managed to eke out a little bit more competitive racing back here in South Africa after I retired from triathlon in 2019, doing some road racing, some cycling. Here is definitely my best ever trophy, winning the Tour of Good Hope in 2020, after which I saw my cycling abilities tail off a little bit, and I'm now just recreationally keeping fit at all 3 disciplines when I can. But today, we're going to be discussing, obviously, from a triathlon perspective, cycling. And yes, it's one of three. And I always tell my triathletes, it's 50% of the race. So if they want a PB, this is the part to focus on. So what are we going to be looking at? I'm going to give you a little bit of insider's perspective. I think the triathletes on listening are going to nod their heads. If you're a medic treating triathletes, bios, doctors, physios, and this is not your sport, I hope you'll get some insights into what kind of athletes you're dealing with. We'll look at the specific demands of cycling within triathlon, comparing road bikes, time trial bikes, and from a physio perspective, what would I assess in a triathlete with cycling in mind, and what are some of my strength and flexibility interventions? So, triathletes. We're a bit of a crazy bunch. We are definitely, mostly as a generalization, your type A personality, juggling 3 different disciplines. We're so competitive and highly, highly driven. And it's a real achievement to finish triathlon, whatever the distance, can I be honest. Balance is a problem because life's busy, especially my busy corporates who have family commitments and then they're doing 3 disciplines. And I often check how much sleep they're getting. And I think of all the athletes, my triathletes get their least sleep. I always had a rule, more training, more sleep, because training is catabolic, it breaks your body down. Your most anabolic activity is sleep. Like me, a lot of triathletes go into it as a second sport. And so something to consider when you're treating them, dealing with these athletes is, what was their previous sport? What's their previous conditioning like? And if it's their first ever sport, then obviously there's a whole different baseline to work from. And do they have any injury baggage like I did as an athlete? Most of them will join a club, train with others. And so then you've got this herd mentality of people are doing what other people are doing and trying to follow the stream. And I like to check if they're coached and how specific their training plans are. It is sometimes harder to treat a triathlete, so specifically with one injury, because they won't decondition. So this can be an advantage. As a physio, I'll often tell the athlete what they can do, not what they can't do, and they can keep up their cardiovascular fitness and their strength with one of the or 2 of the other disciplines. And then you just have to be careful that when they come back to, it's usually running that they're off from, if I'm honest, that they don't do too much too soon because they actually haven't deconditioned. So that's one of the things that I think is very specific as a physio treating triathletes. And the other thing I found, and this applied to me as well, is that everything is in a straight line. So you can look very fit, but actually you can be functionally quite weak. I'm a big fan of screening programs and I look for a lot more control, and I'll get my athletes to do stuff in different planes of movement so that when they move in a straight line, they're moving efficiently to the best of their ability and with less injury risk, if I'm honest. So what are these injuries? As I mentioned, the bike is 50% of the race. It should reflect at least 50 to 60% of the training. Obviously, there's from a treatment point of view, if they've fallen off the bike, there's an obvious trauma, and that must be rehabbed appropriately. Majority of injuries, when I see with my cyclists, they haven't fallen off. It's not from a fall. And so for me, if you're on a bike and you're sore and you haven't fallen off, you've got to check setup and technique, because cycling is quite kind on the body. It's all concentric movement patterns. There's no impact, stretch shortening cycle on the muscles, very different to running. And so if someone's sore just from cycling alone, I have to check those 2 things. And I learned this later in my career, if I am honest, that you treat the symptoms, but look for the cause. So yes, they could come in with a tight hamstring. Why is the hamstring tight? And I'll always go to setup and technique questions. And then with your triathletes in particular, you're thinking about the demands of the triathlon bike. It's a much more aggressive position. In my practice, these are the most common injuries I see with my cycling injuries with my triathletes. So cycling, very nice infographic here. What's required during pedaling? You've got 2 phases, the power or push phase, which is from 12 o'clock top of the screen to 6 o'clock. There's your muscle activation. These are the muscles that'll be working there. You've got a pull or recovery phase from 6 o'clock back up to 12 o'clock. And there's your muscle activation. Another nice graphic here showing very similar play to the previous picture. And you have to remember with cycling that while the one leg is in push power phase, the other is in pull recovery. And so for efficient pedal action, as I've written here, you need the muscles to be good, all the good strong muscles with good trunk stability. Otherwise, you have an inefficient pedal action. And certainly that compromises their speed, power, and then can link in with some injury risk. So bike considerations. Now, in terms of triathlon, the specifics, I always work out, I mean, every triathlete comes in with different levels of experience and ambition. So I'm looking to see, are they a novice or experienced cyclist? First of all, this will make a big difference in terms of their ability on the bike. And what is their distance? We're looking from sprint distance of riding 20 kilometers to Ironman of 180 kilometers. And what's their goal? Because there's a big difference in the athlete who just wants to finish it and the athlete who wants to win it. And the risks I take with those two athletes will vary. And then are they on a road bike or a time trial bike? And we're going to discuss this a bit more. And as I've mentioned, setup is key, guys. These are the things that I would summarize that will affect your bike selection and setup. And finances has got to be up there. This is not a cheap sport. Starting out, you could throw a lot of money at it. You don't have to. But financial considerations, certainly for the athlete, is probably the priority initially. And then are they on a road bike or a time trial bike? And then you're thinking about just simple bike selection things in terms of frame size, saddle choice and positioning and aero bars and things like that. So what's the difference between road and a time trial bike? We've got some good pictures here to give you just a quick snapshot. Your time trial bike, TT bike, has a more upright seat tube angle and a shorter top tube, a shorter head tube. You can see where that is on the picture. Flatter handlebars, and your gear shifters are on the end of the aero bars. You can see that demonstrated quite nicely on the right-hand side pictures. What effect does this have on the body? So the body position is lowered. This reduces the drag. You will sit more forward of the crank. That's what attaches to the pedal and drives the mechanism. Your neck will be in more extension because your torso is lower. I feel that it does put more strain on the lower back, glutes and hamstrings, this position, much more aggressive. And there will be an increased hip impingement position at 6 o'clock at the top of the pedal stroke. And I definitely feel for those who haven't sat on a road bike and a time trial bike, it definitely takes more control. So a total novice will feel like you've put them on a cliff edge if you stick them on a time trial bike. And the positioning is very, very different. Looking at a few more things, you've even got differences in road bikes, from more comfortable endurance bikes to the more aggressive aero race bikes. And then you could put aero bars onto a road bike, or you could actually have the time trial frame, and there's your TT bike position. And the picture at the bottom there is quite a nice example of the two different positions. You see that lower torso. There you can see a more forward position on the crank, and on the far leg, you can see that you've got a little bit more hip impingement. So as we've mentioned, we can open up the position of the hip at 12 o'clock, but we close it off at 6 o'clock. And there's going to be an effect on your lower torso and hamstrings. I do think it's harder on your neck, and I'll say this is someone who's got quite a short neck and struggled with the TT position. You have less control with that position, and you need to think about, can they sustain the position on the aero bars? For me, you need to remember, and this is quite common knowledge, that 80% of the drag, so the resistance that an athlete will experience on the bike, is from the rider, not the bike. So yes, the bike position, the bike aerodynamics will change things like that, and we're going to discuss that now. But the rider's position is 80%. I have this discussion in terms of the race distance, where we balance out their aerodynamics with power. Now, I always chose comfort over aero because I just couldn't hold the position for 180 kilometers. And if I was sitting up to get relief and coming back down, I'm losing any aero effect. And so to slightly tail off my aerodynamic positioning and stay there for the whole time with a good power output, for me, worked out best. But this is different for different athletes. And I encourage my triathletes to consider this. As a pro, I was never the best looking position on a bike, but it did the job. And so if there's an athlete really struggling with an aggressive aero position, we start to play around with that, and it's a game changer. Hydration options here, I'm talking about water bottles, being able to access your water bottles, especially the longer that you race and if you're in hot climates. And for anyone working with an athlete, there are different regulations for UCI. So if they are racing a time trial race under UCI regulations, their bike has to be fitted on a rig, and there's much stricter regulations. If they're doing a triathlon, there's no regulations in terms of the alignment, the positioning, the measurements on the bike. You have a lot more freedom. So if you've got a triathlete that's signed up to a time trial race, make sure that they have checked they're compliant with UCI regulations. So aerodynamics. What's all the fuss? We know it's because it's one of the main resistance forces that slows you down. Okay, other forces include gravity if you're going up a hill and the rolling resistance on your tires. According to Aero Coach, you can measure your aerodynamic drag with your frontal area measurement and your drag coefficient. And the lower that is, the more aerodynamic you are and the faster you can ride at the same power. And we'll often talk about free watts. So the same power will take you at a higher speed. And this is why it creates so much interest, and you can go down many, many rabbit holes. As I've mentioned, the body position is the big thing to be looking at for aerodynamics, but you can also look at everything from the aerodynamics of the bike frame, hidden cables, flatter front ends. Helmets provide different aerodynamics, so do your bottles, so do your pedals. I mean, it's insane. And then obviously the clothing they're wearing, tri-suits, aero socks, shoes, things like that. So consider, I did a tiny bit of research on this. Obviously, I'd looked at this as an athlete. I have a little rule. The more competitive you are and the more money you have to throw at it, the more aerodynamic you get. Here, Aero Coach will show you the difference in aerodynamic drag with your hand positions in different positions. So the hoods is the top section of a normal road bike. The tops is the top bar. You've got quite a lot of aerodynamic drag there. If you go onto the drops, your body position is lowered. So of course your drag reduces. Then if you go onto aero hoods, it's even lower. And if you're in aero bars, then you've got the lowest. Okay, and if you sit up on the aero bars, you back up to what it's like on a road bike, which is why you need to try and stay aero on your aero bars. If we were looking at the wattage penalty for your bottles, I mean, that's insane. The print is quite small, and I'm thinking that I wrote it down here, but there we go. You can see in terms of your biggest one is your 900 ml bottle on the down tube. And if we were to put this, which they did very kindly, into a time penalty, so over 180 kilometers in Ironman distance at a 5 hour 30 speed, which is roughly 33k per hour, that's the time difference. Your quickest one there is your 400 ml down tube aero bottle, which is about 20 seconds. No, your quickest one is your 500 ml saddle bottle, 20 seconds. And then your biggest time penalty is for your 900 ml down tube bottle. And that's 3 minutes 30. So over an Ironman, it's 3 minutes difference. Now, to most athletes who are just trying to break 16 hours or happy to finish in 14, 3 minutes is not worth looking at. But if someone's trying to make a Kona spot, that could be the difference between making it or not making it. And one other example of aero, I'm not sponsored by anyone. This is just random stuff. I want to show you why people get so stuck on aerodynamics. Here you've got the difference in terms of helmets. So you really can spend a lot of money and spend a lot of time. And this is personal. This is up to the athlete, if I'm really honest. But this is all quite dry. So let's play a little game of spot the difference. Here's me on the left. I'm racing the world champs in Las Vegas in 2012 as an age grouper. I'm on a pretty mid-standard, mid-level road bike with some nice aero wheels and clip-on tri-bars. On the right, I am racing the 70.3 world champs in ZLMZ as a pro, and I'm on a time trial bike. And even I am the worst guinea pig. I've mentioned to you, I struggle to find an aero position, but you can even see the difference quite clearly there. I'm more forward of the crank on my time trial bike. My torso is a little bit lower, and it does look a little bit more aero, but I'm not a good example. So let's give you a good example. I pulled this photo of Ruth Astle. I do know her. Ruth, I haven't requested your permission for this photo. I hope you don't mind me showing you as an aero goddess. She also started out at Full On Tri, along with Sarah Lewis. Full On Tri has produced 3 of us female pros. They've both exceeded my abilities. Here, Ruth is demonstrating, and she's, significantly good aero positioning. She does wind tunnel testing. She's gone the whole hog, and she's looking at every single watt and minute, second that she can take. And you can see, there's hardly a gap between her hands and her head. This creates a nice arrow funnel for the air. Her bike, there's no loose cables on her bike. And this is also an athlete who, like me, a shorter athlete, she's a bit shorter than me. Personally, I struggle because I feel my biomechanics are awful. I have a short neck, a slightly kyphotic thoracic spine, thanks to some mild Shermans, a long body and short legs. really, I just struggled. But here's a small athlete. I don't know her exact body proportions, but she's made it look good. So with a bit of work and effort and playing, you can get there. I always felt it took about 6 months to get used to a new bike and to tweak it to just right. And here it is so important in terms of considering the two things that I said there: aero comfort, aero power. Okay, aero versus power, aero versus comfort. The longer the distance, the more those things come into play. So heading back to your bike injuries. Biomechanically, we want to avoid small asymmetries and deviations from the sagittal plane. You're riding forward in a straight line, and you don't want to lose force sideways. They need a stable pelvis and lumbar spine so that while their glutes activate, they're not losing anything at the hips or the lumbar spine. And then they need to keep the knee in line with the hip. And for me, they also need independent trunk control that allows normal breathing. What does that look like in terms of what we should watch? So if I can, I'll always pop someone on either the watt bike, or I get them on their bike and video them there. I'm looking at their back alignment. Is there any side flexion through the lumbar spine? I've got a video of that to show you. Do they have any excessive posterior anterior pelvic tilt? Their hips, do they rock side to side or they hitch? The knees, do they track up and down straight over the toes, or is there a bit of swing? So one knee can come in and out, they can do a figure 8 in, out, or they can even have a windswept knees where they're sitting skew, so both their knees are sort of windswept is a great description. And then at the feet, what's happening in terms of the foot position? Is there any medial lift? So is the foot slanted like that, or lateral lift, foot slanted outwards? Do they toe in, toe out? You've got to check their cleat alignment. And is there any scoop on the up? I like to watch that when they're fatiguing. So remember the things we're going to watch. I am the queen of video. I realized I actually didn't have a lot of good videos available that I had requested permission for, but I've got 2 to show you. This is a young triathlete that I've been working with up in Zimbabwe. He's a super talent, and turns out he's got a true leg length discrepancy and a very weak core. So we've been doing a lot of work with him. Oh, I've lost my clicker. On the left, we're looking from the back. As I say, I didn't take this video, it got sent to me on an iPhone, but you can see some side-to-side tip of his lumbar spine and a little bit of a hitch on that right hip. His right leg is the shorter leg. This doesn't show fully from the back the positioning of the feet. I'll show you that from the front. But when you slow a video down, you can really see what you need to see in terms of any rocking. I don't like to see a cyclist rocking. They are losing force in the coronal plane, and they're creating different loads, adverse loads in terms of down the limbs. And then from the front, if we play, it's not the longest clip. I might play it twice for you. Watch the right knee. And it goes. So we did adjust his cleat. He's doing lots of strength work with me. Yeah, he hasn't got any injuries on the bike. He's actually had very few injuries since working with me in terms of a robust core program. But if he started doing a lot more cycling, this could show up with some knee pain or hip pain and various things like that. So troubleshooting. This slide gets very busy. Wait till the end if you want to screenshot it. These are my quick tips in terms of what to look at for setup. So if the seat's too high, you'll see them rock side to side because they're trying to reach, and they're also often overstretching the hamstring. So they'll present with either lower back pain from that side flexion rocking, saddle sores, or a tight or a niggly hammy. If the seat's too low, I find they get into too much knee flexion. For me, it'll overload the anterior knee. That will be the predominant. This is my cheat sheet, guys. This is my generalizations. And I feel it'll overload the quads or patella tendon. If the seat's too far forward, again, you get that very an increased amount of knee flexion. And I find that it'll overload their anterior knee. A cyclist shouldn't come in with anterior knee pain. Not uncommon in running, but in cycling, it just shouldn't. And so this is why I said you can come back to these things to look at. They will also have increased ankle dorsiflexion. I don't often find, you never know if the calf's sore, it's something to think about, but usually it's the anterior knee. And the seat too far back, and actually I had this once and I got a little bit of a biceps tendonitis that settled quickly, thankfully, but you end up pulling with your hamstring quite a lot and your gastrocs. And so those are the 2 areas that you might find muscular pain, or you might find that they get a little bit of lateral knee pain, which is exactly what I had. If they cleat position, so how they clipped in, is too medial or lateral, I'll see that the foot will tilt, okay, and then they'll have a change in the alignment at the foot and the knee. And with the beginners, you have something on the cleat called float, where there's a little bit of play on the cleat. And you can go from no play, zero float, which is great in terms of energy efficiency because everything you put in goes into the drive chain. But it's quite hard to get used to as a novice. So I do tend to say, what's the cleat float? And the more experienced riders, I don't mind them having much tighter. The more beginners, a little bit of play is a good idea. The time trial bars, they should be roughly your shoulder angle is about 90 degrees. So you're starting to think about incorrect frame size if you're not seeing that. And then actually the aero bar length, as a girl, I often had to cut aero bars down so that I could reach the ends and make sure that I wasn't stretching to overreach. Width of the cradle cup, so what you rest your elbows in, they've gone towards very narrow because it kind of channels the wind down through. You have to try that if you've never done it. It's crazy difficult handling. And I also found it very difficult for my shoulders. They do build up the side so you push against it. But, you know, it's funny, someone could come in with neck pain and they've gone and changed the cups to very narrow. And it's one of those questions that when you're in the sport, you ask. And if you're not in the sport, I want you to know how to ask it. And so I bring it up. And then I've mentioned in terms of the bike frame will affect the athlete. If the frame's too small, they're very crunched up. They'll sit too far forward. If the frame's too big, they can react in two different ways. They might really flex to the thoracic and protract their scapula to get there, or they'll just get a big lumbar lordosis and anterior pelvic tilt to reach. So technique. So when we're thinking about the effect on the lumbar spine and hip alignment, if they're pulling up using their lower back muscles, they will hip hitch and side flex. If they have arthritis in the hip, they'll often try and avoid getting into that full flexion, and you'll see them gain hip tip or posterior pelvic tilt to give the hip more range. So these are some technique spots you might have, and then you can ask yourself, hang on, what's behind it? The knee. Now, I have a little rule. If the knee is sore with my cyclist, I check seat and cleat. Personally, I feel that the knee reacts to what's happening above and below. So usually it's responding to something at the hip, which could be the saddle position or their action there, or the cleat position, what's happening at the foot. So exactly as I've written there, these are the things that I'm looking at when I have a cyclist come in with knee pain. And then I always do check for lateral tibial torsion. So if they have some lateral tibial torsion, they will want to toe out a bit. I don't change this in my runners, and I'll give them a bit more grace on the bike too, because if you keep the foot pointing forward, the knees will squint and touch together. And so a little bit of play on that can sometimes be a game changer. And then, as I've mentioned here, in terms of foot position, I like to look on the upstroke. What are they doing? If they're doing a lot of scoop, they're really using their calf to try and get there, probably overusing it in terms of what it should look like on the pedal action. If they've got some medial lift of the foot, inside hammies and calf, and then if they're toeing in or out, is that habitual, or is it biomechanical because of a lateral tibial torsion or a femoral retroversion, anteversion? I do see, I've had a triathlete who had a hip labral issue and saw so many different physios and bios. And when I videoed her on the bike, and unfortunately I don't have the videos, she really pedaled with a toe in position. And she was massively impinging her hip every single pedal stroke. We did a lot of changes on the bike. She actually ended up getting a different bike and correcting that pedal action, which she couldn't correct until she'd seen it. And everything settled down, and she's gone back to racing half Ironman distance pain-free. And, you know, because if you just treated her hip, you wouldn't get there. You just wouldn't fix her, because then she gets back on the bike and she impinges it. And so these are game changers if you're struggling with your athletes. Treat the symptom, but what is the cause? My personal insider tips in terms of helping my athletes, I found single leg pedaling really good for my technique. As I've mentioned, when I've got an athlete, triathlete or cyclist coming in with low back pain, I'm thinking about pedal technique and their positioning. I think my older athletes don't do enough strength work, and the bike is more forgiving than run. but I do encourage my triathletes. It's so hard because they're already doing 3 disciplines, but as I've said, they're all in a straight line, and they actually often can have a weak core and can be conditioned strength-wise. And if they can find some space in the off season to do some really good strength work, it comes back in spades. And ITB, the first place I look is the cleat and shoe position. If they've got numb toes, as a quick check, you can think about the positioning of the cleat again. Is it too high, putting pressure onto the ball of the foot? So if the cleat position is too near the toes, it will make them go numb. And then I try and get my runners and my cyclists to bring in their shoes, and I have a look at their shoes, make sure the fit's good. So just a quick thing, but that I hope most people are looking at with them. And then thinking about bike considerations, remember everything's in the sagittal plane. We're considering their range of movement and their power. I love symmetry. And cycling should be a very symmetrical sport. You want a good left-right balance. So if there's asymmetries, it's going to create a problem. The biggest area to look for really in terms of the pain with a lot of the triathletes is for hip impingement. And then consider the body proportions, as I've mentioned, because it does affect their cycling position and what they can achieve well and what they can't. We're looking to avoid those asymmetries, deviations from the sagittal plane. You want all their force to take them forward and to reduce any adverse loading on the body. For this, they need a stable pelvis and lumbar spine while they're activating the glutes and hip flexors. And they need to keep that knee aligned with the hip. We don't want lots of drift on the knee. They will start getting a sore knee. And then lastly, as I've said before, that independent trunk control. So what are the classic complaints I deal with? If they're saddle sore, this is personal. I do talk to my athletes about things that I found and see if it helps them. It is, there are triathlon specific saddles. For those that you haven't seen them, they've got often a gap down the middle that offloads pressure. That they are worth it if you're spending all your time in an aero position. And I'll also encourage my athletes in terms of anti-chafe and a good chamois, good cycling shorts, money well spent, and not to wear pants under your cycling shorts. You're gonna get some painful rubbing there. If with the knee pain, as I've mentioned, seating cleat. Neck pain, we're looking at the aero position, how aggressive are they? And I've even just had novice riders, and they are gripping those bars for death and getting some neck tension. And sometimes when you can just point out that that's what's happening, a rider can start to breathe, drop their shoulders. And then, as I've mentioned already, with the numb toes. With my triathletes, so many of them are stiff in their thoracic, especially if they've got a desk job. Mobilizing this area and stretching this area are so helpful. They do get a lot of tightness through hamstrings, glutes. Again, sitting. My worst is my desk jockeys that are cyclists, and I tell them, listen, you have got to stretch glutes, hammies, hip flexors, because they are in that shortened position for their working day and then the bulk of their exercise time. And then I like to see if, people that have ventured into triathlon, and this often happens, they're a good runner, they swam at school, they get lots of running overuse injuries, and they think, well, I just have to learn to cycle. And they have what I call the runner's stomp, where they cycle like they run and they just push down, they're not thinking about push and pull. So a couple of things that I pick up mostly with my triathletes. Right, from an assessment point of view, these are some of the things I'm considering in the subjective assessment. You've got to discuss their training volume, any changes to their equipment and to their training. I get a feel for where they're at in terms of their triathlon journey. You've got your intrinsic and extrinsic factors to think about as well. This is what my triathlon examination might look like. I make sure that I'm documenting information about their bike. Have they had a bike setup? What's happening in terms of their swim and run as well. But obviously we're going to focus on the bike. Biomechanically, so I'm a fan of a screening tool. I love screening my athletes and then showing them A, where they can get faster, and B, where they can avoid injury. I've pulled a few of these from my triathlon screening tool. These are some of the main things that I'd probably look at just with cycling in mind. Their thoracic, a range of movement, so there's rotation, but we're looking also at how kyphotic they are, what's the extension like, are they stiffer one side than the other, their lumbar range, flexion and extension particularly. I might check a knee to wall just to see if there's a massive difference between left and right, because as I said, you want symmetry. It shouldn't really affect it would affect their pedal stroke right at the top if they had a particularly stiff ankle. Thomas test is probably my biggest checkpoint for them, because we're looking at hip flexibility, ITB tightness, and also rectus femoris. And because it's a double biarticular muscle crossing the hip and the knee, the rec fem could come into play. And a tight rec fem could give you some knee pain. Craig's test, I'm looking for femoral retroversion, anteversion. Obviously, I'm going to check straight leg raise, and looking for a leg length discrepancy. If a triathlete and a cyclist has a leg length discrepancy, I mean, they do say you can get away with 0.5 centimeter to 1 centimeter. I don't like any asymmetry. You can get cleat spaces for road pedals, the Shimano's. Not so easy for, to my knowledge, they're not available for mountain bike SPD pedals. But that could be, the lift has to be under the cleat. In a runner that's a heel striker, you can put a heel raise in. But for the cyclist, and I've had this with my little Zim athlete, he's got a difference in muscle bulk, left to right, longer to shorter leg, 2 centimeter quad difference and a 1 centimeter calf difference diameter, so circumference, should I say. And so we've put a cleat spacer in, just to try and keep him symmetrical, because all the training he's doing, his shorter leg is bigger because he's reaching and stretching and working it more. And then this is my little check for lateral tibial torsion right at the bottom here. This is lateral. This is an example of lateral tibial torsion. And this is an athlete that might run toed out and they might prefer to cycle toed out. We're not going to change this biomechanics. So I note it and I explain to them why they do that, and we go with it. So biomechanicals. Movement test. Again, this is pulled from my triathlon screening program. These are a couple of the movement tests that I might video and I might look at with quite a lot of detail, I might add, because it's, you know, the devil's in the detail, guys. And I was an example of a high level compensator where I could execute a movement very well, but I was cheating terribly doing it. And I did have and have had my share of injuries. And I must say, my physio ability kept me racing much later in life than I think it should have. And it was so good to have that physio hat on. And now I can say that having done all that, the athlete in me, it makes me a much more empathetic physio. And I certainly learned the most about all my injuries about treating injuries from my own injuries. So if I go through these tests, there's a standing leg swing. We're looking as if there's a trunk tilt. So from the front or the back, you'll see, is there a trunk tilt sideways? Does the pelvis rock forward, backwards? Is there balance poor? And are there any fixing strategies? Examples, 2 examples of what I wouldn't want my athlete to be doing there. This is a great test for running as well. But here you've got control through the central longitudinal axis. You've also got lumbar pelvic dissociation to execute it well. You've got to have a good proprioception, which is always wonderful in all your athletes, and a cyclist still needs this. So there's so many things that we can see in terms of just this basic test, and is there a difference left to right? The standing knee lift is the easiest of the tests I give my runners. And for cyclists, I'm looking at a few different things here. Will they hitch the hip to lift? Will they lower one arm if they put the arms up above? Does the trunk tip to the side? Does the hip lift true? Does the leg lift up straight? And are there any fixing strategies? And if they can't do this well, and they get some of those things wrong that I've shown you in the examples, it bodes badly, guys. This should be an incredibly easy test. Fixing strategies is facial fixing. Do they purse their lips, bite their tongue, bite their lip, stick their tongue out? They won't do that if they're talking to another athlete or trying to take a drink or breathe normally. And foot fixing strategies will often give you a clue about their proprioceptive ability. And you certainly can't run on a clawed foot, and you wouldn't want them cycling on one. And it's such a small thing to mention, but the fixing strategies, if that's what they need to do for the exercise in the gym, and they're not doing that when they're training or racing, then they're going to break down and have injuries. Your seated knee lift. We're looking to see if the hip hitches on the lift. Does one arm drop down? Does the trunk tip to the side? Does the leg lift straight? I've got them on an unstable base, so I'm seeing some core activation, I'm seeing some lumbar pelvic control, and again, I'm seeing what's happening at the hip in terms of the control around hip flexion. Your dynamic lunge, probably the single most helpful exercise to look at in your runners and cyclists. Again, what's their knee alignment? Do they get the medial knee collapse or knee valgus? Does the trunk tip sideways or the pelvis lose control? Tip because of a weak glute medius? What's happening in the trunk? Do they use their arms to get back? So they've got a lazy glute max. And have they got any foot fixing strategies or facial fixing strategies? So you're not just saying, oh, they can lunge. Really dial into the difference, the ways they're performing it and what they're doing to achieve it. Where do they struggle? If in doubt, get them to perform the movement as slowly as possible, and you'll see where they struggle with it. I have a little saying, speed hides need. And so when I give my core and my rehab, I try and get the athletes to do the exercises slowly so that they are, and with all my cues in mind, so that they're achieving them perfectly. Last few exercises that I like to look at, movement control, the Superman. I do like to test this with a 500 ml water bottle between the shoulder blades. They're not allowed to let that fall off. Amazing how much more activation you need, core activation you need to keep that there. I'm looking to see if the head rotates back as they do the lift. Do their shoulder blades wing? That would be more important for your triathlete swimmer. Or the chest drop on the unsupported side, or does the pelvis shift? Does it lift up as a compensation, or does it dip down? And do they arch their lower back to achieve the movement? And there again, you've got a really nice indication of core stability and lumbopelvic control. The seated hamstring test is a gem. So I just position them on the chair. I try not to cue them too much, and I get them to roll the ball out and back a few times. You're getting a nice idea of their dynamic hamstring length. And also you're looking particularly for their lumbar pelvic control. Do they lumbar flex to achieve the movement? Can they fully straighten their knee? If not, they've got tight hamstrings, what's happening? And if this, and a person who struggles with this, apologies, the dogs are going to bark in a second. A person who struggles with this is going to be coming in with something linked with their lumbar spine, glutes, and their lower back. And finally, the step up, another simple exercise. You know, often I'll video something and then I'll look at it really slowed down. Apologies about that, guys. 2 seconds. And so with the step up, what's happening in terms of the hip alignment? Again, are they hitching? Is there any knee collapse, medial knee collapse and knee valgus? Watch them on the descent as well. So on the up, and what's their control like on the down? And actually with a high step up, I find it's quite a good exercise, and I've got a couple of videos to share with you on that. So simple movement. You could even do a higher step than I've demonstrated there, and it'll give them a good idea. And you know, you could have quite a high level cyclist, triathlete come to you, and they can't control the descent. And then when you show them that, they realize that there's a functional weakness that they need to deal with. And then you've got them on board. Otherwise, they're never going to fit in any strength work that you give them, because there just simply isn't the time. Right, interventions. I've got a couple of my favorite stretches, as I've mentioned, for my cyclists and triathletes, particularly if they are doing a lot of riding on a time trial bike in a very aggressive position. Their priority areas: hamstrings, glutes, hip flexors. Okay, I've got 2 different glute options here. The pigeon, which is personally my favorite, but not everyone will like that, or a glute stretch against the wall. The hip flexor stretch, I've combined it with knee flexion to bring in rec fem, but you can adjust that for your athlete. Personally, my adductors get really tight on a bike. And any medial knee pain, I'm looking to the adductors. I release them, but then why are their adductors tight? I have my own theories about mine, and I've got 2 adductor stretches there that I like. It's adductors. I always warn my athletes, they don't like stretching. You coax them, you don't bully them. A couple of neural stretches. I've called these neural stretches because they're just a bit more dynamic. They bring in your thoracic. And for me, the thoracic is a key area that isn't always dealt with. I had a triathlete come to me years ago. He was a pilot and he had calf pain. He said, Parys, I can't even run 10 minutes. And I thought, this has got to be his lumbar spine. Assessed him fully. I mean, everything clear, all the, Thomas test, straight leg raise, lumbar spine clear. His calf was a little bit tight, but it wasn't his calf, and something was paying to his calf. The only thing I found on this athlete was that he mid-thoracic on the same side, he was stuck. I hammered it. I mobilized it. I gave him lots of rotations and stretches. I told him, listen, go away, try a run, wrote in my notes, send for a scan. And he phoned me the next day. He said, I ran half an hour, no pain. I treated him once more and he never had any pain again. So don't overlook the effect of the thoracic on your athletes. And I like mobilizing through there, especially because I'm particularly stiff with my Shermans. So we've got a couple of lovely neural stretches here that just change it up a little bit. They are my go-to favorites. And a dynamic one. So I've got a little video here. I work with Ron. He's a biokinetist at the Santon Emperor with me. I've learned so much from this guy. I'm giving him a little bit of airtime. He's actually going to be doing a talk on the tendon special interest group, and we're combining it with the runners group on his very unique approach to managing tendon injuries. I can't wait for it. This is a little drill he got me doing, which I absolutely love. It's a really nice combination of some functional strength and flexibility using the TRX. So this is one of the videos he actually sent me as part of my rehab. And have a look. So core control needed. Little glute max there. Going into a really nice hip flexor stretch. I'm so tight. You're going to see me start to wince. And then going into a lovely proximal hamstring stretch. Bringing in some controlled lift. Good activation through there. Absolutely divine. Doing 5 sets each side, 10 sets each side. Absolutely lovely combination of different movements and different things there. So you can make the flexibility, doesn't have to be glamorous. This is a much more advanced example of some functional stretching, but you've got to tell, I tell my athletes, they've got to do some stretching if they're in that aggressive time trial bike, and you've seen my favorites. Basic strength work. Here's a leg press. This was me on my program when I was still doing some road racing. The emphasis really is on perfect execution, guys. I was doing 10 sets of 10 reps of 100 to 110 kgs. It's a slow, controlled descent. I'm not letting my lumbar spine flex or lordoze, and I'm driving through the heels to achieve the movement well. So getting that glute activation, great quad strengthening. So just as a basic strength work, if you know that your athlete's not strong enough, this is a good place to start if they are a member of a gym. But they've got to pay attention. I've had an athlete come to me, set off a lumbar disc, doing a leg press because as he got into hip flexion, he was obviously allowing too much lumbar flexion, which created immense pressure on the lumbar disc. And so it's a good exercise, but it can go wrong if you're not paying attention to the detail. A core exercise, one of my favorites, I call it dead bugs. Here we go. So they've got to find lumbar neutral, forward tilt, posterior tilt, find neutral, into tabletop or dead bug, like a bug stuck on its back. That lumbar spine does not move anywhere. It stays absolutely stabilized. Start with a heel tap into opposite arm and heel tap, which brings in that lovely anterior oblique sling. The progression is to extend the lever, straightening the knee, and then the progression is longer lever still, leg straight. Watch that they're not tensing through the neck, flaring the ribs. Such a simple exercise, great activation, very, very safe. One of the more safe abs exercises. And my athletes that do vanity abs, sit-ups are a real no-no for dodgy lumbar discs. This is super safe because they are in lumbar neutral. Next up, Superman. Such an poorly performed exercise on the whole, and I even demonstrated it. Oh no, my volume should be down. So find lumbar neutral and then maintain that. If you really want to make it harder, balance a bottle between your scapulae, your shoulder blades. Arm lift. The leg lift, they mustn't lumbar lordoze. It's heel away from head, not up to the ceiling. And then they're getting that lumbar pelvic control. I'm weaker. Can you see I slightly tilt and slightly lumbar lordoze? My right hip flexor is super tight, so I was really struggling with it there. But what a great little activation exercise, and one of my real go-to core exercises, and totally appropriate for your triathletes and your cyclists. So that's the Superman. I love this wall squat. I see so many athletes come to me with anterior knee pain and they're squatting and their knees are tracking so far past their feet. This squat teaches them lumbar pelvic control, and they're not going to overload the anterior knee. And I will show you that now. And again, volume down. Feet have to go forward so that when you squat down, you're getting a vertical shin. I tell them to put their hands on their sit bones and take their bum straight down, the sit bones straight down to the floor. Once they can feel that, they're thinking about not arching the back. They can bring in an arm lift. Very hard not to lumbar lordosis with that. As soon as you do that, dropping into the squat without that lumbar lordosis, you will feel your core switching on in a totally different way. So such a simple exercise. You can progress it by adding on weights, a medicine ball in the hands or dumbbells in the hands. But for me, just executing that movement well can be a game changer for someone that has been struggling with that lumbar pelvic control. A back lunge, I've got a slight variation here with a slider mat. This increases the eccentric hamstring component, but obviously we're going to be looking at loads of things here in terms of controlling the knee position, the hip position. So there's no contralateral pelvic dip, there's no medial knee collapse, and trunk alignment is upright as well. So I see athletes lean forward. I see that when they lunge, their knee tracks forward. I want them to sit into the lunge so they're getting a glute lunge, not a quad dominant lunge. And this is just a wonderful exercise for your cyclists and for your runners. I use it a lot. It's surprisingly hard. 30-second reps of that, and I'm stiff the next day. Here's another Ruan gem. Thank you, Ruan. You are a guru. This is a TRX hamstring, I think. Yes. I like using the TRX. It is quite advanced. You want to teach, so either TRX curls or hammy curls on a Swiss ball, because you want the athlete, the cyclist, to be able to activate hamstring for that pull phase. So here you can also bring in a slightly, you can make it as dynamic as you want. I'm doing quick concentric phase, slow eccentric phase. Okay. Core is active. I'm making sure that I'm using my glutes, pushing my heels down into those stirrups, not using my lumbar spine. Really divine exercise. But I would start most athletes on the Swiss ball curl before going on to this. But what a nice example of some strength work for your cyclists. Oh, sorry, I forgot to change the title here. So this is a high step up. And again, we can change the play in terms of the speed of the exercise and how they perform it. And you're aiming for perfection, guys. So big step up into that hip drive. And then how slowly can you lower down without losing the positioning at the knee and the hip? Fantastic exercise in terms of that hip extension that they need on the bike. So your glute max activation, and driving up and lumbar pelvic control as well. So lovely exercise. Start with body weight. You can have a higher step, and then you can add in a sandbag, holding some dumbbells, you name it. Let's go. And here a little bit more of a plyometric. So this is the reverse hip drive action. Let's play this. Slow down, big pop up. So I was doing this to help me with my sprints in bike racing. Just to try and get that little bit of explosive speed, that little bit of kick. Actually, it'll be super functional for any runner, triathlete as well. So just a nice little plyometric version. And then here, a good hip driver. I've added a sandbag, start with body weight. Make sure that I do flex the free leg, so it stops you getting some lumbar lordosis to achieve the movement. Make sure you're pushing down on the heel, so that it's a hip drive, glute max. Again, your hamstring and glute are working in a really nice action that will transfer onto the bike super well. And I think we are there. I'm hoping that I talk far too quick. I estimated that those 40 slides would take me a little bit longer than they did, but hopefully there's some good questions. And if I flash through anything too quickly, then open to questions and we can go back to some of those slides.
No, thank you so much, Parys. No, I think you went through everything great. I must say I'm very impressed by the videos of you on the TRX machine. Especially that first one, the cyclist functional stretching. I must say, I don't think many
Again,
people can do that.
Try it for your running, Megan, please. It's a it's a
You know when
goodie.
I fall on my face. Yeah. So currently we've got one question here from Martin Jordan, asking, with cyclists being in one position for a long time during races and training, how do you effectively manage their load? How do you balance, for example, postural education and their cycling specific strength and conditioning?
Okay. Yeah, great question, Martin. Thanks. And yeah, this is, I mean, from a physio perspective, it's on my mind a lot when I'm treating a cyclist, especially one who has a desk-based job and they're hunched over a laptop. You know, the cycling does, it takes a lot of time. So the bulk of your training is spent on the bike. And if you're just a pure cyclist, then again, you're spending so much time in that position, and it is going to take its toll on your neck, on your thoracic, and you're going to shorten through hip flexors, hamstrings, glutes. And you've just got to prioritize regular flexibility work. Some people have more of a buffer than others. So your very inflexible athlete is going to have less of a buffer, and they're going to have to stretch 5 days a week. And your flexible athlete, it might be that actually they need a little bit more strength component or functional flexibility stuff where there's strength and the flexibility work. And I try and be realistic in terms of the time they've got. I'll ask someone, have you got 10 minutes a day, 5 days a week? Or can I set you 2 30-minute sessions that you'll target? If they're like me and they're not a very good compliant patient on their own, then sign up to a yoga class or find a good Pilates class. I do tend to be compliant when I've paid for something, and that would be my recommendation as well. I've done more and more yoga lately, and I wish I'd done it sooner. The effects of it are super, super helpful. So you have an honest discussion, make sure that what you're recommending to your athlete is practical. I'm not going to tell a young dad of kids under 3 that's juggling Ironman training and a busy corporate job that he's got to spend 30 minutes a day stretching. I'm going to give him the key stretches for him. So is that a hamstring doorway stretch? Is it a hip flexor stretch against the sofa? Does he do it just before? And if it helps him, I say to them, listen, stretch before your session and then it's done. Your very tight athletes, if they stretch before their training, they've got a little bit more range to work on in their training, but obviously the ideal is after training. Then they reverse some of the tightening that they'll feel. If there's anything on there that you want me to elaborate on, do put it in the Q&A.
Great. We're getting a lot of praise coming through. I just had a question more for maybe someone who hasn't treated triathletes or cyclists, and also just out of my own interest. I don't know if you covered it, but so sorry if you did, but why is the TT bike different from the road bike in terms of the setup, just so that maybe someone can know to kind of look out for that when they're treating someone?
Okay, no, so the setup, the bikes themselves are different. So a time trial bike obviously doesn't have the drops, and it has your gear shifters are on the end of your aero bar extensions, which are fixed to the bike. Road bike, you can put clip-on aero bars onto. And the positioning is different to get you into a more aggressive aerodynamic position. The whole idea being that you're going longer distances, so you want to reduce the drag and maintain a faster speed for the same effort. Remember, in triathlon, at long course, there's no drafting. So you cannot sit on the wheel of another cyclist. It varies between races. It's somewhere between around 12 meters to 20 meters, the draft zone. You've got a limited time to be in the draft zone and pass another athlete. So you can sit on your aero bars quite safe because you're not on the wheel of another athlete. In a road race, you want to have your hands right by your brakes and your gears, because you're on the wheel of another athlete. So your triathletes are able to be in this aerodynamic position that reduces their drag, improves their efficiency, and they're quite safe to do it because they're not on the wheel of another athlete. And as I mentioned with some of the aerodynamic stats when you start adding them all up, Dave Brailsford was a huge fan of marginal gains. He said, when you start adding all the little margins, you get a big difference. And he's exactly right. And you can do that with the aerodynamic considerations of your bike. It costs money. And some of it is more possible for one athlete than another. So as I mentioned, I struggled with the aerodynamic position just because of my body alignment and my age, if I'm honest. It gets harder and harder to be in that aggressive position when you start getting a little bit stiffer through your back and neck. So there are athletes that can get into a really super aggressive aero, their head is low, they're super tucked, they've got lots of flexibility around their shoulders for that narrow aero elbow position and aero bar positioning. And so be it, good for them, because definitely there's minutes to be saved in terms of your overall race distance. But the time trial bike is a different bike, just like the mountain bike is different to a road bike. You've got a road bike and a time trial bike, and you can put aero bars on a road bike, but there's limitations to how aerodynamic and to the position you can achieve, different to a time trial bike.
And then also maybe just for like a rookie or someone starting out, if they may be training, indoor or even on a road bike, is it essential to have someone kind of come and do your bike setup, or is there some way that someone like can do it themselves? Anything that they should kind of look out for?
Actually, that's a great question. I say to my athletes during half Ironman or Ironman, look, have a bike setup done by someone that this is their job, because it's so worth it. Make sure that you're if you've never ridden your first bike, you should get a bike setup so that you're in a good position. If not, I mean, Dr. Google or shots of my talk will give you some good ideas of what to look at in terms of the positioning for seat height, up, down, and seat forward, back. And also just an idea in terms of frame size. So things to consider: your overall height for the frame size, but also your inner leg measurement is quite important. So those are some of the things you think about in terms of selecting the right size bike for you. And I would get advice there, either from the bike store, or make sure you are seeking out someone that does bike fits. I think it's money well spent. By the time you've had a bike set, you've saved yourself about 3 physio sessions. So it's worthwhile doing it. And the longer you go on the bike, the more important. Okay.
Great. We also have a question here from Andrew Jones. So if you had a 1 centimeter leg length difference, would you try and shim for the whole difference, or use a shim under the cleat in combination with a shoe insert? Or do you only aim at a partial correction? Yeah, that's great. I mean, a 1 centimeter difference is big. Often we will go in stages. So I might put in a 5 mil correction. I think if you start putting inserts into shoes, cycling shoes are usually quite tight, and it's not a lot of space inside. And now you might start getting numb toes or Morton's neuroma, things like that, from your foot being squashed in a cycling shoe. So the best place to correct a leg length discrepancy is with the cleat. Either build up the cleat or put a cleat raise in there. That all gets quite bespoke and specific, actually. You can buy off-the-shelf cleat spacers at a lot of the bike stores. But if in doubt, and you've got inserts for your running shoes, you can get inserts made for your cycling shoes. You do need to make sure that you go half a size up on the shoe, so that especially if you're in hot races and your foot is swelling, you don't start getting real problems in terms of the pressure around the foot. Even with the right size shoe and a triathlon shoe, which is quite open, allows a lot of airflow. Towards the end of my Ironman, I was getting hectic hot foot, where your foot is just on fire, just burning from that neural pressure, the pressure inside the shoe. So I wouldn't have coped with having an insert in those shoes. So leg length discrepancy, we usually go in stages. I'd go to a 1/2 to 3/4 correction. If they're fine with that, but they feel like there's more to go, then go for the full correction and perfect symmetry, but with the 1 centimeter, if that's the difference. Great. I just have 2 more questions. So, training for a triathlon, it's obviously brutal, 3 different disciplines. If you develop, say, like a cycling injury and you maybe need to rehab and you're kind of not really allowed to cycle, what should be the athlete's concern for, their deterioration of their cycling fitness? Should they be worried, or is the benefit of the running and the swimming going to make up for any kind of difference, especially since you said that, it makes up the majority of the race. So that's where you want to put most of your training.
Yes, so a great question. So first of all, as I mentioned, on the whole, the bike is quite forgiving. So I find that if they're a little bit undercooked, they're not going to, other than getting a bit saddle sore or a bit sore in the neck or their feet get a bit hot, they'll manage the distance. They just might be slower in terms of the timing. Personally, I think that bike fitness transfers to run better than run fitness transfers to bike. I always overbiked in my training plans because I had a lot of injury baggage from hockey. So I ran a lot less than the other pros in terms of my training. And I would do a bit more bike and a bit less running, and it would balance out. If you can't get on the bike for one reason or another, my option is always to keep plan B as close to plan A as possible. So if they can't cycle and they're supposed to do a 3-hour ride, what can we do that will come as close to that as possible? On the whole, if someone can't cycle, they usually can't run. It's usually running that's the limiter. But would they be able to do any other cardio, be that in the water, on an ergo, on a elliptical? What can they do that's cardiovascular that is as close to what they would do as cycling? Can they supplement with additional core and strength work for the legs? Whatever they can do that's as close to function as possible. And the big thing for me, literally, what keeps plan B as close to plan A? So be less worried in terms of injury risk, but yes, you often see if you're a bit undercooked from the bike, from a fitness point of view, it'll show in the times. And that's just, there's no shortcuts on that. I do think the bike's loyal. I'll say to my athletes when I was still coaching, the time you put on the bike comes back to you. It's a really loyal one. That swimming is so technical. So often you put hours in and get 30 seconds quicker, which just wasn't worth it. And running is certainly more technical and harder to get right. So cycling the most loyal, but time off the bike, build back in steadily. And then what else can you do that keeps your cardiovascular as close as possible and your strength as close as possible?
Great. I always seem to think that if you were if you were running fit, that you would be able to translate it to cycling, but
you will more than most, but definitely personally I've heard it said the other way. And then actually I saw a video by Kat Matthews, who is the first female triathlete to go under 8 hours for the Ironman distance in a very strategic event, a bit like the sub 2 challenge with Kipchoge. Yeah, it was insane. And she was saying she doesn't run as much as the other pros. Interestingly enough, she's also a physio, not practicing, and also has a hockey background. And then when she said she felt that bike transferred to run better than run to bike, I was like, man, there's so many similarities. I wish I was as fast as her though. So your runner will have better cardiovascular ability just as a general starting point. And they just need to finesse their pedal stroke and their pedal efficiency, because they won't be efficient at that. You will see them. They'll have dead spots in their pedal stroke, which are usually at the top and at the bottom. And if they did single leg pedaling, they'd see it. And that's what I did when I first started triathlon. And I found that the single leg pedaling improved my pedal efficiency, stopped that runner's stomp. But yes, as a general ability, I could get on a bike and ride much more than any other novice, because I had the fitness from running and hockey. Hockey, by the way, gives you very strong legs for cycling. So triathlon to me was a hockey and a rower's graveyard. So many rowers and hockey players would end up in triathlon and would come in quite well just as novices, just because of the leg strength. Rowing is a good leg strength option for someone who can't cycle, but I'd imagine you might not be able to sit on a rowing machine if you couldn't sit on an indoor bike.
I mean, so that a little bit sort of leads into the last question we have, which is that, when you are competing and you're coming to the end of your cycle, is there any kind of change in technique or pedal stroke you can focus on to try and increase your cadence, or make sure your running as you transition through is the best it can be?
Okay, yeah, no, great question. A lot of triathletes, particularly sparked by Daniela Reef, the whole Brett Sutton crowd, would go towards a much slower cadence on the bike. bigger gears, grinding it out. And I used to get so much flack when I first switched to cycling, because they would tell me I was grinding away at a high gear. And that's because the switch from a lower cadence on the bike meant that when I went to a higher cadence on the run, using different muscles, I had fresher legs. So I did like the lower cadence efforts on the bike. I would put a big chainring on the front, have a 54 chainring on the front, so that I could sit at a nice low cadence and use more power. Then when I switched to running, it's a higher turnover. I might spin my legs out a little bit just before I got off the bike. So I might just drop a few gears down, do a little spin, prep my legs for that quicker muscle action. But on the whole, it just practice makes perfect. I'd say to any triathlete, do some brick sessions. So where you run off the bike, that could be bike run, or it could be run, bike, run, run, bike, run, bike, run. All those sessions are absolutely fantastic. And I discovered, to my surprise, when I first did my triathlons, that I got off the bike and would start running with these horrible jelly legs and think, this is awful. And then I'd look down at my splits, and actually they were surprisingly good. So I learned quite quickly that it felt worse than it was. And the more you practiced it, running off the bike, the easier it got. And I have never done a standalone run time that's quicker than my triathlon run times, because I was warm, and even though it felt a little bit wobbly for the first few K, it was never that bad. So yeah, you could spin your legs out if you want to, but basically just tell yourself you're going to get off the bike. It's not going to feel too special. You're going to have these jelly legs, and you just run them out, and off you go.
Great. Thank you so much for the amazing talk. We have, like, there are so many compliments coming through. And just so everyone knows that we will be uploading this recording onto the WiSH YouTube channel. Thank you so much, Parys. We really, really appreciate it. I'm sure if people have other questions, they can, kind of email through to the WiSH email address. But yeah, I know people definitely have said that they want to go back and go over the recording so they can take some of your tips. And I'm sure also Rohan's biokinetic tips as well. Just for the next upcoming webinar, so we have about a 2-week break, and then it's going to be a Josie webinar, the return to play after spinal injury. And just for everyone to note that it's at 6:30, not at 6. And yeah, once again, thank you so much to Asino for sponsoring these webinars. And yeah, thank you so much, Parys. I don't know if you have any questions or any last words of wisdom that you want to send out to everyone?
No, thanks everyone for listening. I hope you found some information useful there. And just to any of the physios and biokinetists treating triathletes, definitely feel there's a few little tips there. And my take-home point, if they're sore on the bike and they haven't fallen off, setup and technique, you got to go there. And otherwise, you're not addressing the cause.
Great. Thank you so much. I'm sorry I hijacked some running questions at the end there.
Oh no, that's that's my keen area, so we're good.
Yeah, thank you so much.